Hi there, it's Dr. David Green, founder and CEO of R3 Stem Cell, the global leader in regenerative therapies. I'm continuing on with the FAQ video series, and I'm up to number 42. Who is not a candidate for a stem cell therapy? So let me talk a little bit about who is definitely not a candidate. If someone has cancer and they are receiving active treatment for that cancer, such as chemotherapy, then stem cell therapy will need to wait. And I'm not talking about like a bone marrow transplant as treatment for that cancer. I'm talking about as treatment for something other than the cancer itself. All right, the stem cell therapy that we offer is not a cancer treatment. And if somebody comes and says, well, I'm getting chemo and this and that, I was wondering if I could also get the stem cell therapy for my kidney issue, we need to wait. All right, we want to wait until about 6 months or maybe a little more until after the cancer treatment is done and remission is achieved. Another contraindication would be an active infection. If the infection is unrelated to the reason somebody's coming in for stem cell therapy, what will happen is our providers will do the treatment and the stem cells will get pulled away because infection consists of a lot of inflammation too, and the inflammation will pull those stem cells. We don't want that, so we like to get the infection taken care of first and then do the stem cell therapy. I mean, if somebody's getting antibiotics for an infection, those can be damaging to stem cells too at times, so it's better to just wait. Now, if an individual is pregnant or lactating, we'd like to wait until those are finished before performing a stem cell therapy. Now, if a person comes to us with a condition that stem cell therapy has been shown not to really have any evidence that it can work well for, then we're a little skeptical of offering that because we don't want someone to spend the resources to get the stem cell therapy with very, very, very little chance of it working. So for instance, up until recently, we didn't have a lot of evidence that stem cell therapy worked well for Parkinson's disease. But over the last 5 years, several research studies have come out showing how well it can work to help create new dopaminergic neurons, and we can see significant clinical improvements. So for Parkinson's, we do offer stem cell therapy, and the results have been fantastic. The last issue I feel compelled to discuss is the severity of certain conditions. And I'll use the example of kidney failure. If somebody comes to us and they're in stage 5 kidney failure and their creatinine is 5, 6, 8, 9, and their GFR is less than 8, which means that they have less than 8% of residual kidney function, then we will turn them away because there's very little chance of it giving us the bump in GFR that we want to see and keeping patients away from dialysis. So we try to use evidence-based medicine to make the decisions as to whether a patient is a candidate or not. There are absolute contraindications like the pregnancy issue or relative contraindications, and some of those come from clinical judgment with our consultants. All right, visit us online today at r3stemcell.com. Call us to get your free consultation at +1 844-GET-STEM to see if you or a loved one is a candidate at one of our 70 centers in 7 countries to receive one of these revolutionary regenerative procedures. Thank you.